Welcome to the Career Cafe and a segment we call Industry Insights. Our goal here is to help bring you insights into how to make work for you. And we do this by bringing you accomplished leaders who are making a difference in the community and in their own careers. In today's inaugural interview segment, we have Hardeep Chaggar. Hardeep is the Executive Director of Systems Optimization at the Fraser Health Authority, a $4 billion healthcare provider here in Western Canada. Hardeep has built a career that started in finance and has moved into operations and supply chain management over the years. And he's developed a keen sense of how to enable business through systems, technology, and agile methodologies. Hardeep is an action-oriented leader who relishes in what he's doing, not what he plans to do. Hardeep, thank you so much for doing this. Really appreciate it.
Yeah, sorry it's taken a few days to get online with you. It's been pretty busy and hectic within the healthcare sector with everything going on. So thank you for having us.
No, I really appreciate it. I mean, we know that the front line is as busy as can be, but in talking to you, I know that the team that supports those people are equally as busy. Just give us a real brief description of what's happened for you and your team over the course of, I guess, the last, say, 3 or 4 weeks.
Yeah, I mean, about 4 or 5 weeks ago, we started to see the wave of COVID-19. I think a lot of people within healthcare and probably outside healthcare thought that this pandemic or the virus was kind of out, in Asia, and it really wasn't going to make its way over here until it was declared a pandemic by the World Health Organization. And I think since that day, it really started to significantly change the way we're working and really what happened within the healthcare sector. I mean, we still have it easy because we're in the back office. We're providing technology and supply chain and data support, but it's really the frontline clinical staff that are really suffering. That gives us a great purpose to come to work to make sure that we can do whatever we can to support them.
Yeah, I mean, I can only imagine. I know how it's affected us and our team and how real it got about 3 weeks ago when we sat in our office and looked at each other and said, you know what, I guess it's time to go home. And I guess for you and then the frontline staff, it's just amped up that much more in terms of what everyone's been responsible for. So on behalf of everyone who's listening to this, we're certainly thankful for everything that they do and that you and your team do as well. So let's shift gears a little bit and talk about what you're responsible. So your title, Executive Director, Systems Optimization. Tell us a bit about what you and your team do there, because the scope has grown as your tenure with the organization has gotten longer. Tell us a bit more about what you do.
Yeah, actually, Victoria, our CEO, came up with the group's title of System Optimization, which is really system thinking around business acumen, process, but really powered by data. So in short, I'm head of analytics for Fraser Health, and we serve around 1.8 million Canadians. So everything from descriptive analytics to predictive analytics and machine learning, and building products of real-time dashboards. That's really what we have really focused on over the last 6-8 months. But with system optimization comes all the business challenges. And so over the last 4 weeks, we've been thrown into leading the supply chain for Fraser Health as well, along with the data analytics piece. So that's primarily my role here. It sounds like a small task, but when you've got 25,000 employees and 1.8 million Canadians to serve, it becomes pretty challenging very quickly.
Yeah, absolutely. I mean, what you're talking about there all sounds very innovative and leading edge. And forgive me for saying this, but it almost sounds like it wouldn't necessarily something that comes out of healthcare in Canada. Can you talk a little bit about how that mindset and how that type of initiative came to be within Fraser Health?
I think it is who I am. Firstly, coming from industry, I don't know any other way. I wanted to work somewhere where it was meaningful and purposeful. And so over the last several years working with healthcare, bringing that industry perspective around innovation, data technology, and supply chain thinking has really started to pay off. But it was really exponentiated by our CEO, Victoria Lee, who has this innovative nature. She started hackathons at Fraser Health, many years back, And so that's really where it began for Fraser Health. And, having met Victoria, we realized that we could actually do something very different within the Fraser Health environment. So when you come to system optimization in Fraser Health, it really is like a startup. It's like something, an environment where, we run Agile, we run Scrum, and it's an environment where really we want people to come in and do their best work. So you think you come and work with us, you think you're in a tech company downtown.
So you're talking about systems and technology and Agile. When I first met you, you're predominantly a finance guy. At least that's how I positioned you in my mind, as a finance guy. You're running finance and accounting for a major transportation organization, and then over the years I've seen you move and shift from a career perspective from that into general management, supply chain management, technology. How do you think about yourself, and how do you think about your skill set and where you're going in your career?
Yeah, I mean, like Jeremy, my mom really sent me to finance school and says become an accountant. So that's what I became in the UK. But it really wasn't where my heart or my interest was. And then having worked in industry, banking, and finance and aviation for many years, I kind of got fed up of the numbers and having to explain the numbers after the fact. So for me, it was like naturally working upstream to try to find out, what is going on, what's driving these numbers, what are the drivers behind the numbers. And so that's really where my supply chain career began. So, I never really went to school formally to, learn supply chain. It's been learning on the job for the last, 15 years. And working on the shop floors, working on the aviation engine shop floors. And here it's working on the front lines with the healthcare providers. So to me, as I told you, a few years back, supply chain is no longer this way. It's no longer the silos. Supply chain is everything, and it's horizontal across everything that we do. So, and supply chain is data related, right? So we move data, we move people, and we move product. So
yeah. So let's just take a real quick tour through your background. So a number of years working for a major helicopter, like a CHC helicopter. And then you did some time they had you go to Australia for a while. You came back to Canada. You spent a little bit of time in healthcare, I think, and then you went to a company called Build Direct Technologies.
That's
and tell us a little just briefly what you did at Build Direct and who
you know my resume better than I do, Jeremy.
I had to get prepared for this conversation, So before going back to in healthcare to Fraser. So tell us just a little bit about that the Reader's Digest version of that journey.
Yeah, I mean, it starts further back than that, because coming out of school, I started working in aviation companies in manufacturing in Europe. So we would make Eurofighter canopy seals, for the Eurofighter aircrafts. And then I took a break and actually went into to banking and finance, and I was with JP Morgan for a while. And then coming back into industry, I saw a lot of similarities, no matter whether I was in banking and finance, whether I was in plastic manufacturing or aviation and manufacturing. It was all supply chain, and there was all numbers at the end of it. So I was either working in financial planning analysis, I was working in supply chain and accounting, and so it doesn't really matter what industry you're working for. There are some core principles that can be applied through it. Coming into healthcare, it's exactly the same thing. You have the economics to deal with, but you have throughput to deal with. It just happens to be that the throughput here are human lives and how we take care of the patient. In aviation, we call it total quality management, and in healthcare, we talk about the quality of patient care. So there are all these key pillars which are the same no matter if you go to aviation or you go to healthcare or you go to banking and finance.
Does that change how you when you're at work, knowing that there's such a meaningful impact of what you do? It's a human life. It's a family. There's so many things that are interconnected with that. Is that something that you lives with you while you're at work?
Totally. I mean, I've had so much opportunity to go back into aviation over the last decade, but every time I've landed it and said, I want to be connected to purpose, and the purpose for me really has been within healthcare, because behind those numbers is a human life. And so
Yeah.
you really see the impact that you can have on human life. So at the age that I'm at now, I'm less interested in profitability, but I'm more interested in how I can make a difference to a system approach to humans, and it just happens to be healthcare.
That's awesome. With what we're trying to do here with this is the inaugural segment of these interview series is I don't want to put us on an equal footing by any stretch, but in my business, we have the opportunity to really impact people from a career perspective. It's how they pay their mortgages and their rent and put food on the table. So if people can make better decisions, and like we said at the beginning, to get work for them and knowing how to navigate through their career, I'd love to get some lessons from you about how you've navigated through your career and made some choices to get to where you are. Before we get into some of those components, with what's going on right now with COVID-19, how is COVID-19 impacting supply chains? We've got a big supply chain audience here. So how is it impacting supply chains inside of healthcare? And then from your perspective, how do you think it's going to be impacting supply chains outside of healthcare?
I think, I mean, it's very close to my heart right at the moment. What I've seen over the last month and 6 weeks, we have really had a huge panic across the globe on whether it's personal protective equipment, masks, gowns, gloves, without fully really understanding what we need. We don't get a lot of we don't have a lot of confidence in, should we be wearing masks outside of hospital settings or shouldn't we not be? So the public have this fear as well. So that puts pressure on the supply chains on what product is available. So we really have been, I think the world has somewhat been reactive. What I found is that the organizations that have really got ahead of the curve are the organizations that have applied some form of data science and analytics to their supply chains, and what I call supply chain architecture. So looking at, where are we going to be? And we know that we need gloves and masks and gowns today, but where are we going to be in 6 weeks' time? And so I have a group of data scientists that are working specifically to identify what are the shortfalls that are going to be coming in 6 weeks' time, and looking and scanning the globe around those supply chains. So that's something that we're doing here at Fraser Health to make sure we stay ahead of the curve. That's meant that we've had to work closely with our provincial partners to get ahead of the curve on procurement activities, whether it's local or whether it's foreign procurement. So that's what's happening within supply chain. We've definitely seen consumption of things like hand sanitizer, mask, being consumed at an exponential rate, which we can all understand. So it's how do we support those demands? And so I try to, a lot of it for me, supply chain is education of the people around us, because not only have we seen our demands of supplies increase, but we've also seen supplies decrease. So it's actually a multiplying factor, because the distance between the two got greater over a very short period of time. So that's a lot of education internally within our organization. Externally, what I'm seeing is, the US definitely aren't helping with are they allowing product across the border? Are they not allowing product across the border? We see a lot of our imports come through the US and then freight forwarded to BC. So now we're having to divert shipments that are coming, that come straight to Canada. We're also seeing a lot of fake products in the marketplace too. Mm-hmm. So, I'm getting phone calls and emails every day that I know someone that has a factory somewhere in the world that can produce these masks or PPE equipment. And what we're finding is that the quality really isn't where it should be. So Fraser Health has done a really good job in making sure that products are quality approved before we buy them. And so we're seeing these small companies starting to form to start push product and distribution. The thing that I find really fascinating is that our Minister of Innovation has done a really good job in inspiring local businesses to tool up, to produce locally. We saw recently that yesterday, in fact, that there's a company in Coquitlam that's tooled up to make N95 respirator masks. One of my leaders said to me once that amidst every crisis is an opportunity, and I try to seek out those opportunities. And never did I know that implementing Scrum and Agile at Fraser Health was really in training for where we are now. We've delivered more technology dashboards, products, real-time real-time data workspaces and predictive analytics. We've delivered more in the last 3 weeks than we have delivered over the past 6 months. How did we do that?
Why has that been able to happen?
Well, I think firstly is because we trained our people on Scrum and Agile and the ability to be okay in failing and incrementing and adapting and getting user feedback, in close, tight cycles. So, they've had the training, so there wasn't a shock factor when the request started to come through. We went from, within healthcare, we went from what was very agile to a command and control. So we have emergency operations centers, and the emergency operations centers are, asking and demanding a lot of real-time data. So we have squads of teams that are building products. And so there is this huge urgency, and out of necessity, we're moving quicker and also not perfecting every product before we release it. We're allowing our end users to provide feedback on the fly and adapting as we go.
So I want to expand on that idea a little bit. So necessity, out of necessity came this sense of urgency. I've got to act now. And I wonder, from a career management perspective, when you're thrust into a situation where you need to make a change, and I think this is human nature, how that can be a motivator to get something done. And one of the things that I would love to be a proponent for is to help inject some of that thinking into our philosophy about how we manage our career. As opposed to being reactionary, what can we do to be more of an author of our own design by taking action, as opposed to hoping to or thinking we might, and laying the foundation to move you in that direction. It's just human nature, isn't it? That when out of necessity comes great creativity and an action orientation that you might not otherwise have.
Yeah, I mean, as humans, we're survivors, right? So we're going to do whatever it takes to survive. Yeah. I think when you come into a workplace, when you're under normal working conditions, not everybody operates under that same vein. Mm-hmm. So, the level of risk taking significantly reduces. The red tape bureaucracy that is in place definitely inhibits innovation at the pace that we've seen it over the last month. For me, Jeremy, I naturally am that person that's going to, push the edges and take those risks and find new ways and innovate. But I'm seeing it now that even during times of necessity, some people struggle a little bit in, so what do I do to take a risk? And I think that's where leadership's really important, because not everybody is, cut from the same cloth, but everybody has a talent, and it's how do we turn that talent into performance, which is really, really important. So, for me as a leader of system optimization, I have around 100 people, all with varying skill sets, but also with varying risk tolerances and capabilities. But everybody has a talent that we need to apply. So I mean, a lot of people have stepped up. And not only here in Fraser Health at work, but out there in the community, a lot of people are stepping up too. So
yeah. So let's help some folks to understand something about the maybe some skills that are that are of demand and might be utilized across a number of organizations. We talked about data. I wanted to ask you, how important is the use of data in solving problems in supply chain, in healthcare, and just in business in general? How does that, how do those things come together?
You know, on the Economist, a couple of years back, it said oil is no longer, the most valuable commodity. Data is. So for me, data is everything. Everything that we do is data. We use data in our personal lives to make pretty much, also support every decision that we make, whether it's procurement, buying on Amazon, ratings and reviews, or whether it's in business. Data is way more accessible than it's ever been. We're producing, more data per day than we've ever seen in our lives. So the challenge is, how do you make that data meaningful?
Mm-hmm.
Data is everything, and then we've seen that certainly within Fraser Health. That after we started to demonstrate how data can be visualized, looked at in a different way, used on the fly versus a rear view mirror. Use data on the fly to make the next decision. Once we started putting those tools in place, what we found was people are approaching us more and more. There's some fundamentals around data, though. You can't make decisions just based on data. You have to have some level of subject matter expertise, whether it's clinical expertise or supply chain expertise, right, or expertise in the area you work. So don't just use just the data. Use data to augment your decisions.
So the ability to contextualize data?
Totally. Yeah. That's really important. And then, we could have a podcast just on data and the quality of data and the risk of data if it's misread and when making decisions.
So if someone is relatively new in that journey of picking up that, because data impacts every component of every business, really, what are some things that people can do to start to become more, maybe take the fear factor out, or just learn some of the basics? Where do you start to learn how to think about data and utilize data in whatever it is that you do, whether it's finance, supply chain, general business, whatever the case is, recruiting?
Data visualization is, for me, is the starting point. So when I have people come into to join system optimization, one of the first projects we give them is take any data set in your life and visualize it and tell us a story with the data. So storytelling with data through data visualization and pictures is the way forward. And so, I love products like Tableau, Power BI. And so I always say to everybody, go and learn Tableau, go and learn Power BI, and the art of telling stories through data visualization. So that's a really good place, because if you can take data, turn it into stories through pictures, now you've got a fighting chance to actually go and support your customers in decision making.
So for someone who doesn't know what Power BI is or Tableau is, just briefly, what are those different programs?
It's basically taking data and drawing graphs and charts with it, but it's more of an interactive tool where you have the ability to hover, drill down. I mean, when we see graphs and charts like what you and I used to produce in Excel, they were very static. You'd still have a question, so it really didn't allow you to have insight. Whereas these modern tool sets allow you to have insights into your data that allow you to drill down into that data set and keep asking questions that are answered on the fly for you. So that's what Tableau and Power BI really allow you to do.
You've used the term democratizing data.
Yeah.
What does that mean?
Data democracy to me is an absolute fundamental, I think, in the society we live in. An example of data democracy is ratings and reviews on products that you buy. So allowing crowd and community to publicly score products, that is an example of data democracy. We now can buy products based upon what our crowd and community are rating that information on. Data democracy, for example, in what are the lineups at hospitals or emergency rooms? How does data democracy be made available to the public? And how do we democratize that data so that we as a system can fix the system versus a few individuals trying to fix the system individually?
Right. Yeah. Interesting. Yeah, absolutely. So in the sake of time, for sake of time, one of the other things that I wanted to talk to you about is that this pandemic that is occurring has had a huge impact on people's physical well-being potentially, right? An impact on lives from that perspective. There's another impact, which is the emotional and mental component. I mean, the journey that I've gone through over the course of the last 3 weeks, getting used to working at home and the realizations that come with that, and some of the things that have been wonderful learning experiences that I love about it. But there's other impacts on your family and having kids at home that aren't in school. There's an emotional, mental component. You've been a huge proponent of mental health. Talk to us a little bit about what your viewpoint is on that, being able to navigate through your career and work and all the other people that might be listening to this to be able to maintain a positive or real mental health as we navigate through this thing.
Yeah, I'm in mental health. I mean, I've often shared publicly, I have lived experience myself, and having come through a mental health journey, when we entered into this COVID-19, it was the first thing that came to my mind, which is, right, what is the mental health impacts this is going to have on both the people within healthcare, but also people that are isolated at home. So for the first thing is, I actually don't know what it feels like to be in your shoes, Jeremy, which is isolated at home, staying at home all day. In fact, my life got turned the other way around. We've been doing 20 hours a week for the last 3 weeks straight. Oh, sorry, 20 hours a day for the last 3 weeks. So that in itself is going to have a mental health impact. Every time my phone goes, I have PTSD, thinking, okay, what's the next problem I got to solve? So that's a challenge that we got to think about. And how do we create buddy systems in our workplace to make sure that we're really supporting each other's mental health? It's something that we need to talk about regularly. It's something that we talk about every day on our daily check-in with my leadership. How is everybody's mental health? On the other side, when people are at home, we're seeing the government invest more and more into situations where there's abusive households, where women and children are in places of danger. So we saw the government this week invest money into those areas. So we know that even in social and domestic settings, there's going to be mental health challenges both for families and individuals. I saw that alcohol sales is up. So with that comes an impact to our society. So I think it's very, very important. I think my personal opinion is that COVID-19, we will find hopefully a vaccine for it, but the mental health scars that are going to be left from this are going to be, decades to come. Our children are sitting at home and not socializing with their friends, going to school every day. Their lives have changed. And we have mothers and fathers sitting at home with their children, cooped up inside the house, and too scared to leave the house and not knowing what to do. So I think that the mental health challenges are really unknown at this point, but it's definitely something that we need to not wait until it's too late, but to start talking about it now. So, thank you for raising that.
No, absolutely, because it's not something you can immediately see. Everybody has something that they're working through, and I think that as we close this off, just to be mindful of that the person next to you, the person behind you, and in front of you, there's that part of the human condition. We're all managing through something, right? And how we do that is important. And they say times of crisis don't necessarily they kind of reveal who you are in situations like this. So just be mindful and supportive of the people around you. It's funny, it can bring the best out of people, and it can bring the worst out of people. So then that's a choice. Just make a conscious decision as you go to work and you go out in public that you keep those things in your mind.
I'll add two things to that, Jeremy. I having gone through this or going through this now, I wake up in the morning and I do ask myself, and I say to my wife and my colleagues, I ask myself, who do I want to be through this journey? So managing me now, I can, be an empathetic, compassionate leader, or I can be a leader that just drives, throughput regardless of the people. I know who I want to be, which is that empathetic and compassionate leader. And what that means is that we really need to take time and coach our type A staff who want to work around the clock to say, that, and I say this to yourself and everybody listening, which is there's three key components to manage your mental health. It is, you got to get sleep, you got to eat healthy, and you got to exercise. I know it sounds really basic, but those are the three fundamentals. And anybody that comes from lived experience in mental health, those are the first three things that you got to put in place. Make sure you're sleeping, make sure you're eating healthy, and make sure you're exercising, even if it's a little bit a day. So really important.
And I love the fact that it's basics. Get the basics, get the fundamentals down. And I couldn't agree with you more. Just getting some sort of daily exercise, move, something going on. It doesn't matter what it is, just do something.
The fact that you're dressed as good as you've ever been, you've had a shave, and you're sitting on the other side whilst you're sitting at home. I think that's a good sign, right?
This is true. You should have saw me yesterday. I had a pretty massive beard going on. So at least this got me to shave. My wife's happier for it. So Hardeep, thank you very much. I mean, you guys are so busy. Everyone thanks you for the efforts that you guys put in. Thank you for making time with us. I really, really appreciate it. And we'll have to do this again at some point, maybe on a different topic. But thank you so much. We'll go from there, and appreciate it.
Thank you, Jeremy.
So yes, indeed, a big thank you to Hardeep for sharing his time with us and some valuable career lessons, and a bit of a peek into the healthcare supply chain system and the challenges that have impacted it during COVID-19. What did you take from what Hardeep shared with us today? I know for me, there's kind of two main things. One was the impact that data has on business and can have on our careers. And then just the general idea of some of the career advice that Hardeep shared with us as well. Some of those things that kind of stick out for me are the use of data and data science as an important skill to learn regardless of what you do in your career. And seeing how important it's been into how healthcare delivers service to patients. We also talked about how data impacts supply chains across all industries, and that the principles of supply chain are key pretty much regardless of the industry that you operate in. It was interesting to hear how businesses locally and globally are tooling up, as Hardeep had mentioned, to support supply chains during the pandemic, and how data on its own isn't useful, but the ability to visualize data and tell a story with data is. And as far as career advice goes, aligning a purpose can help achieve greater satisfaction. We heard Hardeep talk about when he was in the transportation space, when he was in banking, not that he didn't enjoy his time there, but really feels a particular connection with the healthcare space, and how that can impact when that's present, that can have a positive impact on your career as a whole. And how Scrum, Agile, and the willingness to fail can be a huge career asset. And then lastly, we talked about mental health and how that's key to a successful career, and nailing down the basics. And it was interesting to talk about the fundamentals of mental health is eating, sleeping, and getting some exercise. And so over the course of the last 3 weeks, as we settled into what we're all kind of working through, I'd ask you, how has your sleep been? What is your diet consisted of? And are you getting a bit of daily exercise? And I think that I would back up what Hardeep has to say there. If you include those things, you're probably better off for it. So to close this off, what story does your career data tell? And how could you help someone visualize the outcomes that you've made in your career? And I think if you can tell a story around those things during an interview process, that you're going to set yourself up for success for sure within that process. So thank you so much for joining me on the inaugural Career Cafe and Industry Insights. It was a lot of fun to go through this. If you've liked what we've got here, I've got a lot more planned over the course of the coming months. And whether you want to watch, listen, or read, we've got you covered. So if you prefer to watch this stuff, you can head to our YouTube channel at Horizon Recruitment Inc. Go to the Career Cafe on the Horizon Recruitment website. So go to horizonrecruits.com, and there's a link to the Career Cafe there where there'll be a written summary of what we're talking about here today. Or you can just simply subscribe to the podcast. Thank you very much. Until next time, we'll see you from the Career Cafe.